Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and here we're today with Tal, who's come in from LA to see us for a herniated disc problem that he's been dealing with. Now, he's already had epidural steroid injections in his lumbar spine, and that didn't help really too much, did it? For about a week only? Yeah, and we see a lot of patients with herniated discs from all over the world that come here for our special manual spinal decompression, which I think that's the videos you probably watched in on YouTube.
Yes.
So, Tal's a YouTuber, and we're happy to have him here in Houston. And we're going to analyze him first. I'm going to show you what the exam looks like on a herniated disc patient. So let's face the mirror first, Tal. Now, I'm going to have you just close your eyes and bend your head forward all the way, and then backward all the way, and then neutral. Okay, now I'm analyzing his posture on a three-dimensional axis, the x-axis, the y-axis, and the z-axis. And he does have a forward head posture, positive SZ cervical listing. He also is translated on the cervical and head to the right. And he's also rotated on the z-axis on his head. His right ear is lower than his left ear. You're a side sleeper, aren't you, Tal? Sleep on your side mostly?
What do you mean?
Do you sleep on your side most of the time?
Yeah. Sometimes.
Yeah, okay. See, I can usually tell that by everyone's posture, so that's why I analyze everyone's posture to see exactly what they're looking like three-dimensionally, which really shows up exactly the same as someone's x-rays does. I've already looked at his MRI for him, and he does have a pretty pronounced posterolateral disc herniation at L4, L5, and L5S1. So we're going to do his orthopedic neurological exam for that. So Tal, let's have you lay on your back on this table with your head up this way. Now he gets right leg pain all the way down into his calf, and pretty much pain in his calf here on the side constantly, correct, Tal?
Yes.
Okay, so first test we always do on a patient for herniated disc, that leg pain and back pain both?
Yes.
Okay, so he's got posture straight leg raise, and we're only at about 30 degrees here. Okay, does it feel any better down here?
Yes.
Okay. Does this hurt your back to do that?
No.
Any pain in your leg when I do that?
No.
Okay, that's a Braggart's test. That's negative, so that's good. I'm not even going to be able to bring his leg up high enough to test his psoas muscle, so I'm going to skip that one. Now, this one I'm going to push down. Tell me if you feel any pain deep in your hip joint or your back or pelvis when I do this. No? Good. Just stretching? Okay. Now, tell me on this side if you feel any back pain or leg pain.
No.
Okay, I'm going to keep going. Now, you'll feel a pulling in your hamstring, but that's just the muscle tightening up. Any back pain at all yet?
No.
Now, see, this is his unaffected side. He has a right paracentral disc herniation, so that means the disc is herniated, pinching out on the right side. So his left straight leg raise is normal. Braggart's test, any pain there?
No.
That's normal. Now I'm going to test his psoas over here. I'm going to push down, you resist. Hold it up. No, I'm going to push down, you try to keep it up. No, hold it up. Resist me. There you go. Good. Did that hurt your back at all?
No.
Okay, good. Let that flop down. Tell me if you feel any pain in your hip joint at all. Okay, so Fabry-Patrick was negative on both sides. Now I'm just going to... This is... Any pain there at all? Okay, good. Good. So let's sit you up and face that. Let's actually face towards Renee this way. Sideways. There you go.
This way?
Uh-huh.
Just stay here?
Yes, just like that. Let's scoot you over this way off that crack there. Yeah, no, scoot your whole body over just a little bit. No, your butt. Just scoot over a little bit. Just so you're not sitting on that. Just scoot over this way a little bit.
Like this way?
No, don't lean. Just scoot over.
I don't know what
Yeah, just move this way. Just move your whole body over this way. A little bit.
Stand up, Tal,
Here,
and then sit back down.
Yeah, just sit on this pad, not this one.
Oh.
There you go.
Yeah. That's all right. That's all right. Just a little communication. So now I'm going to do what's called a maximum compression test. Is there any pain in your spine when I do that?
No.
Okay, now I'm going to go do a right foramina maximum compression test. Is there any pain anywhere when I do that?
No.
This is a left foramina maximum compression test. Is there any pain there?
No.
Excellent. Okay, tilt your head to the right. Is there any pain there?
No.
Is there any pain when I do this?
No.
Okay, that's shoulder pressure negative and lateral flexion is good range of motion. No pain there either?
No.
Nothing? Good. Okay, how about when we do this? Any pain in your low back?
No.
Good. Okay, go backwards. Is there any pain in your neck or back anywhere?
No.
How about when I do this?
No.
Good. Okay. this up, I'm going to push it down, you resist. Good. I'm testing his deltoid now, which is C5. That's excellent. We're going to also be checking his reflexes here momentarily. I'm going to test your biceps now. I'm going to pull out, you resist. Good. Relax. I'm going to push in, test your triceps, hold. Good. Okay, same thing over here. Biceps, hold. And triceps, hold. Excellent. So now we have cleared his whole entire cervical brachial plexus. As soon as I finish with the reflexes, his biceps reflex is normal, brachioradialis is normal, and triceps is normal. And biceps normal, brachioradialis is normal, and triceps is normal. Now let's check his patellar reflex on the left. That's normal. Patellar on the right is normal. That's good. Now this will be the one, if any. Just let this one back. There you go. Let this one in there. Yep. You got a good ankle jerk there, so you haven't lost the reflex to your ankle. So that's a good sign, because if your disc problem was more severe, you wouldn't have an ankle reflex. So he has a good +2 equal and active reflexes all the way through his upper and lower body. So can you stand on your toes and walk for me now for a second?
Walk on my toes?
Yes. Do you have any problem doing that? How about your heels?
No.
No problem there? Okay. Now just stand there with your feet shoulder width. Part of my have you squat down with no hands and come back up. Does that hurt your back anywhere?
Yeah, a little bit.
Okay. Going down or coming up? Coming up more?
Let me try it.
No?
Stand up a little bit.
Yeah, stand up hurts a little bit more. Okay. Now, I want you to bend over like you're going to touch the floor and tell me if you have when and if you have back
Touch
pain.
the floor?
Well, try to, but if you
Okay.
tell me when you
It's
start
too
having
hot.
back pain.
Oh, it's already.
It's already?
Yeah, it's
Okay.
really hurting.
See, he's got back pain there and flexion at about 45 degrees. Okay, now I'm going to have you extend backwards, but don't bend your knees. Tell me if this hurts.
Yes.
Okay, so he has pain at 5 degrees on extension. I know this is going to be positive too. And go backwards and left. Does that hurt more?
No.
Going down?
No.
Okay, we're going to twist to the right.
Oh.
That one's bad.
Yes.
This is a positive Kemp's test on the right side especially, and that's the side, see, that he's compressing the nerve on. So let's have you lay on your stomach for me now. Cal, with your face down in here,
Down here.
and you can rest your arms right there. Now this is Tal's very first adjustment test. You've seen, what, 4 other chiropractors already?
Yes.
And been to like 15 sessions of physical therapy already.
Yes.
Now that tightens up in your low back, doesn't it? See, his right leg is short by 1/2 inch here. When I bring his legs up, it gets even, and see, that tightens up right there, doesn't it? You feel that tighten up in your low back, Tal?
Yes.
Okay, and your pelvis right there is tender. That tender? So he's got a right sacroiliac problem as well, and a sacral problem. So I'm going to have you lock your whole right leg straight and lift this whole leg off the table for me.
Left.
Yes. Does that hurt to do that?
Not so hurt.
Not too bad?
Mhm.
Stiff? Okay, down. Now this one?
No.
Yeah. Okay, sacral deviation test showed a little bit of a deviation to the right, but his sacrum is misaligned on the right. I can feel it, as well as his right sacroiliac joint. L5's out right there. That's sore. That's sore too. L4, 3, all these are out. He's got muscle spasm bilaterally. It means on both sides. Tender right there too. And right there. See, if you see, watch my hands, you can see he's got a little curvature or scoliosis in his spine as well. We haven't seen any plain film x-rays on him yet, but that's something we would probably encourage ordering right away. Yeah, so we know exactly how to adjust him now. He's got cervical out C1, C2 on the left, as well as C5 and C6 on the left as well. T5, 6 right here. T10, 11, 12 on the right. And L3, 4, and 5 are completely posterior in the Z-axis. Do you really feel better?
Mm-hmm.
Okay, all you got to do is breathe for me.
Okay.
First thing I'm going to do is adjust his right sacroiliac joint and sacrum. So I'm pushing those directly away from the L5S1 herniated disc, which is paracentral on the right. So we're pushing the sacrum away from L5, and now we're adjusting his left SI joint. But his right SI joint has internally rotated, so it looks wider than the left one. So I'm actually going to rotate that back around the other way to make that even. Okay, Tal, just breathe normal for me. There's L5. That one's probably pretty sore. There's L4. There's L3. There's L2. Now you'll notice my hands, arms changing in the angle of which I'm adjusting him. Now just breathe normal for me, Tal. There you go. Okay, nice and easy. In and out, just normal. That's it. Let's have you scoot up in the headpiece here a little bit more. Scoot all the way up in here. There you go. He's got so much muscle spasm in his lower back that he's getting compensatory changes up into his thoracic spine, but that all moved really well. And there you go. That's it. Got one more little one right here at T12L1. Okay. Okay, Tal, now I'm going to be putting my elbow right here in the pocket, I call it. This is at the very base of his spine, at the side of L5S1. It's the multifidus muscle, the quadratus lumborum, and erector spinae muscles attached right here. See how tight that is?
No.
You don't?
No.
Wow. Most people would be yelling if I was doing it that deep on them. You're a pretty tough cookie. It's amazing. We see more California patients here in Houston than we did when we were in Visalia, California.
Oh.
Yeah, that's real tender right there. That's a T12L1 and right here. So what I'm doing is I'm getting deep into the trigger points here to help these muscles relax.
Oh.
I know, I'm sorry.
No, it's okay.
It'll feel better when it quits hurting. That's a profound statement, isn't it? It'll feel better when it quits hurting. A lot of people like that one. This is one of those hurt so good moves. It really hurts while I'm doing it, but it feels a lot better when I get done. There. Now see, usually whenever you have a herniated disc, you're in an SI, sacroiliac subluxation, you're going to have a really sore IT band or tensor fascial lata muscle. Is that sore right there, Tal?
A little bit.
On the side? Yeah. All the way down there, yeah. How about this side?
No.
Not as bad? Yeah, see, most everything's on Tal's right side, but look here. His legs are even now, and I bet you this feels a little easier already, doesn't it, Tal?
Yeah.
Than the first one? Yep. So, I am going to get the turbinator out on Tal, first visit. Let's take some deep breaths. I'm not sawing you in half, even though it sounds like it. Most of his pain right down here in his calf on the outside, so I wanted to make sure to get that. Now we're going to play nice for a little while. So this is a much softer touch. People like this one a lot more. Feel like they're getting their car buffed. This is a deep vibration that increases the circulation into the tissue, so it brings oxygen and nutrition into the cells and eliminates the metabolic waste products of normal cellular metabolism. So we're going to get way down in his tissues here to keep that increasing and get all the toxins out. Now he's going to want to drink a lot of water after this treatment today, over the next few weeks, and also we're going to encourage him to put crushed ice in a freezer baggie, a large freezer baggie like you freeze vegetables, and apply it directly to the skin over the low back and pelvis here. for 20 minutes only. That's the state-of-the-art sports medicine, anti-inflammatory and analgesic methodology. So when professional football players or any kind of professional sports players have an injury, including herniated discs, you put crushed ice in a freezer baggie directly on the skin for 20 minutes. It decreases the microcirculation there, which decreases the inflammatory response. But if you leave it on longer than 20 minutes, it actually increases the inflammatory response. So, Tal, let's have you come over to this table now. And I'm going to have you lie on your back with your head up this way. Pelvis, butt right there. Yep, just like that. Okay. Now this is Tal's very first manual spinal decompression, which is full spine. Okay, so what I'm going to do is I'm going to pin this in right here and scoot your pelvis up to where your hips are right underneath that pin. Go ahead and scoot up that way. There you go. I want your hip underneath that. There you go. Scoot down a little bit more. There you go. Now down this way. There you go. Okay, this is going to feel tight. Scoot down a little bit. No, scoot down this way, Tal. Yeah, there you go. Good. That's better. Okay. Now, we're going to elevate his legs up to 90 degrees or parallel with the floor. Sometimes it's always not 90 degrees, depends on the height of the patient. But we always want to bring the legs up where they're parallel with the floor. See, that changes the angle of his sacroiliac joints and it relaxes the paraspinal muscles from his sacrum all the way up to his skull. Feel like you're in there tight enough?
Yes.
Okay.
Very tight.
So, on this one, Tal, I'm going to wrap this around here. I want you just to take a deep breath through your nose, but keep your teeth together. Make sure your tongue's not in there. Deep breath through your nose. And now let it out and relax. Okay, I'm just going to put some traction on here. I want you to relax. There we go. Deep breaths. Deep, deep breaths. Deep breaths. And he's still kicking, ladies and gentlemen. That was pins that hurt the most, wasn't it? Okay, now I want you to just drop your head right in my hands like you're sleeping. There. This is a good old Palmer diversified master cervical rotary brake. That's a great adjustment. I need one myself right now. But here's the interesting thing. I'm going to redo his straight leg raise test on the right side, and I bet you can get this up farther this time without pain. So we will test that and see immediately. So, this is the bad side, remember, and before he could only go up to 30 degrees, so I'm going to do this slowly. Is there pain?
Yes.
Okay, so he's up a little bit higher, about 40 degrees. Okay, so push against my hand. Push. Just with your toes, yeah, pull up. Pull up. See, he's got lack of strength here. Pull your toes up toward your head. No, your toes up toward your head. There you go. Toes. No, pull your toes up toward your head. There you go. Okay. All right, now turn your foot in. Now turn your foot out. Okay, so he's got fair enough strength there. He hasn't lost any muscle mass here, no atrophy yet, so he is very helpable at this point in time in his stage of disc herniation. So let's kind of sit you up sideways now and come over here in front of the mirror for me now. No, come over here. Oh. Now I'm going to have you face the mirror again. Now I'm going to use this instrument, which is a adjusting instrument. You're going to feel a little tap. Now I want you to close your eyes again, flex your head forward and backwards. And neutral. Okay, now here, and flare your hands, hold that like that for me. And see, we're going to bring his head back over his spine more, and I want you to shift your pelvis straight to the right now, or left. Hold it over there. Hold it way over there, though. Yeah. Hold that over there for me. Hold that way over here, though. Okay, hold that. Okay. Okay, now relax. Now, this time when you go forward and backwards with your neck, tell me if this feels a little bit smoother.
Maybe yeah, when I lie.
You still feel pain down here, sure. Yeah, yeah. Now, these things won't go away immediately all the time, but you probably will feel some initial relief. Go ahead and bend over and tell me if it feels a little easier to bend over. Still feeling pain right there? Okay. Okay. All right, so.
Might be a tougher.
Well, he's got fully sequestered herniated disc, which is a bad thing, and it's going to take multiple treatments, at least 12 treatments for him to get over this. So we've got him scheduled to come back 12 different visits in the future. So he's going to be flying back and forth between Houston and LA to get these treatments. And in the meantime, I'm going to refer you to a guy out in LA that can kind of fill in for us.
Thank you.
Very good. You're quite welcome. Thank you for coming and allowing us to do this YouTube video. This is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.